Public health expert, Professor of Virology, Professor Tomori, joins me now virtually. Professor, welcome to the program.
Thank you very much, Melissa. It's a pleasure to be with you.
I'd like to begin with the reports we heard from the WHO. It estimates that COVID-19 pandemic has caused the deaths of nearly 15 million people. What do you make of that report?
I think the WHO Tedros I listened to him, and of course he is telling what is real. The figures are just basically not the real figures, especially in the African region. And so what we're getting, maybe in other countries of the world where they're doing proper testing, we are getting something close to. You also heard that India was disputing the figures they had. So everybody, that's in a country where at least they're doing something. Here, we're not even doing anything. Like you said, a lot of countries have abandoned, so we don't really know. We're walking blindly, and we are deaf to what is happening to us. China is a good example. They're getting cases coming up. America is hitting the 1 million death level this period. And your trailer actually showed now they are criminating bodies. So the problem is still there.
Professor, now also in the same report, the WHO said that India, yes, indeed had the highest total excess deaths in this estimation. It also put Russia, Indonesia, the US, Brazil, Mexico, Peru in that place. Then on the other hand, it says low excess mortality rates. China is on that list. I think China is still pursuing the policy of zero COVID, involving the mass testing and the quarantines. And of course, we know Australia, which is also in the lower excess mortality rates, imposed a strict travel restrictions to keep the virus at bay. And so did Japan, and so did Norway. These countries in these brackets, what do you make of them?
I think it is clear. I mean, countries that have strict zero COVID programs, are detecting it early and treating the cases before they become serious. And that's what is happening. The other countries where you are mentioning, where you are having a large cases, there's this freedom of expression, this thing that we were tired of COVID, but COVID is not tired of us. And that's why we're seeing the disparity in those different countries where you have large number of cases occurring in the US and smaller number of cases occurring in, say, Australia and China, for example. Right in the middle is us. Our low number is probably not because they are low, but because we are just not testing. I mean, you see, even in my country, you see the NCDC report, like only three cases in 2 states testing out of 36, or something of that nature. And that's what we are seeing. So in the figures, the countries where they're getting the numbers, they are testing. In the countries where they're getting the low numbers, like China and others, they're actually doing the right thing and trying to have what we call zero COVID system, in which case their cases are lower, Australia and those other countries. The other places where there's freedom of expression, freedom of whatever, they are getting the big cases. In Africa, we have the freedom, and we have the freedom of not even reporting, which is the double freedom of not following the situation, not reporting, and we think we have a fewer number of cases in Africa. South Africa, where they're doing something great, you're seeing the numbers, they're showing the upsurge in numbers. So if you don't test, and if you don't detect, then you don't know when you have the cases. That's what is happening.
Indeed, and that report really talked about the academics who compiled it, admitted that the estimates were more speculative for sub-Saharan Africa countries there. They said because there was little data on deaths in the region, they said there were no reliable statistics in 41 out of 54 countries in Africa. It's really interesting. They were really saying that it's important to get this data. In fact, one of them said it is important that it's a disgrace that people can be born and die, and then we have no record of them passing. What do you think this is? A lesson for Nigeria, also a lesson for Africa? Because this also takes us back to what we heard and what was said, that, there might be people dying on the streets of Africa. And could this also still be happening with our not testing, and perhaps with the poor healthcare system we still have on this part of the continent?
Yeah, certainly. I mean, we're not seeing the dying on the street. or it doesn't mean that people are not dying. We're not looking out for them. And you see, part of the initial problem we had was that the West decided, or whatever, that if it came to Africa, we're all going to be dying on the streets. Then we didn't die on the streets. Then say, the West has come again. We're not dying. And then we abandon what we should be doing. It doesn't mean people are not dying. People are dying. Let me give you a good example. If you look at our figures for Lassa fever in Nigeria, in 2020, the numbers went down almost half. Now, when we begin to forget COVID and focus on other things, the numbers of Lassa fever cases are rising, are doubling. So we abandoned testing. Everybody put everything under COVID, and that's the situation. We're not reporting the cases, but then people are dying. The studies done in, I think it was in Kenya, showed actually that, it was 50, 60 times the number of figures that are being provided as actually the number of people who die from COVID. So we're not testing, we're not checking, and this is, I think, a important lesson for us. Without data, you can't plan. Without data, you don't know what you have. Without data, you cannot make any headway in the control program that you are doing.
Patients, which we've seen of the virus over the past 2 years. I mean, would you say that the symptoms have also mutated as well? And I'm asking this because, many wonder with vaccines, do we expect more vaccines? And this is to fortify against these mutations.
Funny enough, the symptoms have been the same in most of these basic things we had from the beginning. It took some time to know what it was. But after the first 6 months, we basically knew what the symptoms of COVID were. Gradually, some people went into what we call the long COVID. But basically, the symptoms were the same. You had shortness of breath, there's some confusion, and that kind of thing that we're having. But each person comes up with different. In fact, you can list almost 200 type of symptoms that are coming. But the basic issue is that those basic 4 things about shortness of breath, respiratory problems, and those other things we are talking about. And when it becomes a longer, or what you call the long COVID, you had some kind of confusion coming into the additional symptoms. So the symptoms have not changed, more or less. They remain basically the same. But of course, the viruses have changed, and that's why we're seeing the upsurges that we are finding. You had, a report also talked about different variants of the BA, B2, B3, B4, B5, which are now coming. And I think that's a lesson for all of us. COVID is not gone yet. It's still around, and it's still mutating. And we don't know what the next one will be like. And that's why we shouldn't let off our guard like we have done in most African countries, and especially in Nigeria.
Professor Tomori, do you expect modified booster shots, and do you expect people should be open to taking them?
Actually, we had a meeting today at the WHO group in which we discussed this same issue. Should we continue to use what is on? They are making new vaccines now made out of the Omicron. And there's some suggestions, should we change to that? But then a lot of confusions are going to occur. Many African countries are not even vaccinating. The vaccines we have is of the old index virus. And therefore, to tell people, abandon that one and start with this one, I don't think so. I think the likelihood would be we continue to use whatever it is we have. And if new Omicron viruses come, vaccines come, perhaps they could become used as the boosters. But right now, we stick with what we have and continue. Like I said, even our Minister of Health did mention some of the fact that we have a lot of vaccines around and people are not taking them. So we need to begin to get that awareness to our people. COVID is still around. Your best protection is your vaccine. Please go out for the vaccination. And
perhaps before I let you go, Professor Tomori, I would like to get your thoughts on China's policy. We know that, at the beginning, it seemed like there were so much numbers, and then he took the measures, the zero COVID policy, and then it started seeing a rise in numbers. But of course, it also taking extra measures to shut down cities and do mass testing. This sort of strict procedure to tackling COVID-19, do you think that it is working? And it's also important to note that in this study of the WHO, it is one of the countries in the low excess mortality rate.
Yeah, in fact, a good thing about that, what China is telling us is that we're not free of COVID until COVID is gone in every country. And the important thing is that the figures you expect, if you look at what is happening, if China had not come in with the zero COVID structure, they would probably have more cases than that. Part of the problem that may be happening with China, yes, they vaccinated a large number of their people, but what about when you break it down to the age groups, we may begin to see some gaps. And perhaps what we're seeing now is that since COVID is around and the people see coming to the people, maybe those people, that group of people that already had gotten the vaccination are the ones that are coming down with the infection. So yes, China has done a great thing by having this, but then it is a continuous exercise. Zero COVID has to be zero COVID. It's not 0.01 COVID. And when you leave a group of your people that are not fully vaccinated, then you have a gap on which any virus can come in and cause more community. And that's what they're doing. But of course, China is reacting quite appropriately and making sure that we go back to the zero COVID testing and system and ensure that it doesn't spread. Imagine the population of China. I mean, if they are let go like what we're going, it can be a more disastrous situation than we have.
And they're also making successes with their vaccination. We'd like to thank you. Always a pleasure having you join us. Professor Iwali Tomori is also the Chairman, Special Advisory Committee on COVID-19 in Nigeria. Thank you for joining us on The World Today.
Thank you, Mr. My big pleasure. Thank you.